see you. Well, good morning, everyone, and thank you all so much for coming this morning and for being here. And we're expecting a number of legislators to join us. They're out doing the people's business, so I know they may be coming from committee meetings or meeting with constituents. Delegate Carr is here. I don't know if you've got some other committee meetings, if you have to step out or come back in, so I just wanted to let folks know that we may have some legislators coming and going, and I really appreciate you all coming this morning. A little less than a year ago, I went on a statewide public safety tour. We covered 2,500 miles for 22 meetings and met with over 60 agencies. And after all of those meetings, one thing that really caught my attention was how many local law enforcement agencies told me that heroin and prescription drug abuse was a significant and growing problem in their area. So we started looking into it, and we found that the data supported what we were hearing anecdotally. Since 2011, heroin deaths have doubled. More than 400 Virginians have lost their lives every single year to prescription drug overdoses, mostly opioids. Now, the two are problems in and of themselves. They're also linked because prescription drug abuse often leads to a path of addiction and to the cheap and potent heroin that we're seeing on the streets today. This problem cuts across all geographic and socioeconomic divides. It affects men and women of all ages in every part of the state. So we knew we had to take action. We started working on it last summer and rolled out a strategy of things that the Attorney General's office could do to help combat this problem. It includes education and prevention, prosecution of dealers, and professional accountability for prescribers. And we identified some legislative actions that we think can really make a difference. And that's what brings us here today. For the last few months, we have been working with law enforcement, prosecutors, and a bipartisan group of legislators to develop additional tools to address the growing heroin and prescription drug problem in the Commonwealth. The goal of these bills is to save lives. I don't want another parent to have to bury a child. And I don't want another child to lose a parent to heroin or a prescription drug overdose. In just a minute, you're going to hear from sponsors of some of these bills, and they're going to talk a little bit more about each one of them. But to summarize, there are 4 bills in front of the General Assembly right now. A bill that would create a safe reporting or Good Samaritan provision, as exists in 23 other states, to encourage reporting of an overdose in progress. Second, a bill to expand the current naloxone pilot project to allow any law enforcement agency in the Commonwealth to carry this potentially life-saving overdose antidote. The Center for Disease Control says that between 1996 and 2010, more than 10,000 lives were saved using naloxone. Our office worked on the law enforcement angle of the bill, while Governor McAuliffe's office, in particular, Secretary of Health Bill Hazel and Deputy Secretary of Health Jennifer Lee did great work on the prescription angle. And we have with us today a few folks from the McShin Foundation who have been real champions for drug treatment and naloxone, including CEO Honesty Brackett Liller. Honesty was herself a user whose life was saved by naloxone during an overdose. She's been in recovery for more than 7 years and now works with other individuals struggling with addiction. The third bill is one that would give prosecutors a stronger drug-induced homicide statute that would hold drug dealers accountable when their drugs lead to a death. And fourth, a bill to give probation officers access to the PMP or prescription monitoring program to ensure that probationers aren't accessing prescription drugs. I'm really pleased to say that these bills have been crafted and introduced by a bipartisan slate of legislators and earned the endorsement of major law enforcement and public safety advocates, including the Fraternal Order of Police, the Virginia Sheriff's Association, the Virginia Association of Chiefs of Police, and the Virginia Association of Commonwealth's Attorneys. This is a big problem. It's going to take a lot of hard work at the local, state, and federal level. Education, prevention, and treatment must be a part of the solution, along with the measures that we're proposing here today, because this is not just a law enforcement issue, it is also a public health issue. No one has all the answers, but I'm encouraged to see a real commitment to this cause. Governor McAuliffe has created a task force led by Secretaries Moran and Hazel to look at the issue in a holistic way and develop recommendations, and we are really looking forward to their findings. The federal government is also stepping up. Several cities in Hampton Roads were recently designated by the Office of National Drug Policy as high-intensity drug trafficking areas. Now, while that doesn't certainly sound like a label any city would seek, it can be a great opportunity, and local law enforcement in the region actually teamed up to apply for the resources and assistance that designation brings because they understand this crisis. We're very pleased to have with us Tom Carr, the Executive Director of the Washington-Baltimore High Intensity Drug Trafficking Area Program, which includes Hampton Roads, as well as Deputy Floyd Pond. And we appreciate them being here today and look forward to doing some really good work together. So again, this is a complex problem. It's not going to be solved by one agency or one strategy, but right now we think these bills can make a real difference and hopefully save the lives of Virginians who themselves are struggling with addiction. With us here today, we have a number of bill patrons, in addition to law enforcement officials who are on the front lines of this